Hello, I'm Deborah Chieli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spell, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally, and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview. Today, we're talking with Stephanie Fronza, a registered nurse with over 17 years clinical experience in a variety of settings, including critical and acute care, home care, ambulatory care, and education. She has a unique combination of education and experience, including a master's in nursing education and certification in critical care, nursing professional development, and financial coaching, which is a very cool combination. She leads the way with her passion for lifestyle medicine and ability to really bring this unique perspective to life in the clinic. Stephanie leads the care management team at Progressive Health of Delaware, the only lifestyle medicine practice in the state and arguably the largest in our nation. Progressive Health of Delaware is led by a well-respected physician, Dr. Dave Donahue, and their teams focus on clinical optimization of lifestyle medicine practices for the best health outcomes anyone can hope for in our current fee-for-service model. The care management team is made up of registered nurses, health coaches, and care navigators, all passionate about improving overall patient care and prevention of hospital admissions, and I'm guessing probably readmissions as well. Stephanie is dedicated to personal development and coaching and to improve the lives of her patients as well as the entire team at Progressive Health of Delaware. So we are really honored to have her here. She is part of a team that is making this happen. So welcome, Stephanie.
Thank you so much.
So what I love to start with is people's origin story. I want to hear about your role now, but I'd love to hear how you got there. Like, how did you even get interested in lifestyle medicine? How did you hear about it? Is it something you always were interested in? Tell us about the journey and then your role right now.
Sure. So lifestyle medicine is actually a fairly new concept to me. But when I think about it, it really started back when one of my first jobs was in the cardiac ICU, and you see a lot of these patients go through major surgery, and you think about like, how could this have been prevented, right? If they ate better, if they exercise better. And a lot of it is education for the patient. And when you're working in acute care, you don't have as much time to do that education. You try to fit it in where you can, but it's such a busy environment and you're trying to make sure everything is stable for them. But when I think back, that's really where it started. And I was always about prevention. How could have this been prevented? And I got interested in lifestyle medicine when I had a friend tell me about my cholesterol was high and I went to a plant-based diet. And I'm like, wait, that's all you did? And that's actually worked. And it was such a dramatic drop in her cholesterol and my cholesterol was starting to creep up a little bit. And I was like, I'm going to do that too. So it was just like overnight, I got rid of all the stuff in our house and I switched to a plant-based diet. And so my family had to as well. So that's where it started. And I saw the impact it had on me, my energy level, my husband's health. And I was like, I want to tell everybody about this and I want to share this knowledge with everybody. And I thought I was a pretty healthy person before I switched my diet, but it's a whole different level. So then I had one of my nurse practitioner colleagues said, hey, have you ever heard of Dr. Donahue? And I'm like, no, who's that? And he has this practice in Delaware and Wilmington. So I started like researching about him and his practice and what he's doing. And I said to myself, if he ever hires a nurse, I want to join his practice because what he's doing is just so incredible. It was weird timing. So about 2 weeks later, a job opened up. It was just all very weird. The stars all aligned. So I jumped on the opportunity and I haven't looked back since. So it's only been about 1.5 years that I've been with Dr. Donahue's practice. And I'm continuing to learn and grow even more about my lifestyle medicine knowledge. So that's my journey. I guess it's a long story, but
Oh, that's great. I love it because you had a personal experience, right? And I think that's really impactful. So just as a side story, Deborah and I are members, and I think you are too, of the American College of Lifestyle Medicine. So did you discover that group, that resource? What role has that played in your journey about learning more of the evidence and being able to put it into practice?
So that was really key as far as learning the 6 pillars and what the lifestyle medicine way is. There were several videos on there. When I first started, I was able to watch them. And recently, I have everyone that starts, I have them watch the 4-hour, I'll tell you the 4 or 5 hours. I forget the name of it, but it's an overview of lifestyle medicine that is offered free, which has been really helpful for new team members. We just hired a new team member and we had her go through that class. So I use the journal articles, the newsletters, I've jumped on the meetings a few times, and that's been helpful to learn from other nurses. But it has really been key as far as learning the lifestyle medicine way and what everybody else is, doing out there so we can learn from each other.
Yes, I agree. And the free offering you're talking about is the one that came out of the White House effort?
Yes.
That's what you mean, right?
Yes.
The free okay. Yep. So I wanted to circle back, tell us about your role now. Tell us about the role that you hold right now in progressive health and the team that you have.
Sure. So I came on and there really wasn't a program to take care of the sickest patients. So we immediately developed a care management program to look at those patients with multiple chronic conditions. How do we prevent them from going into the hospital? How do we prevent the readmissions? So we developed a whole care management program from scratch. So that's one of the first things that I did. And right now, I'm still doing the nursing work and talking to patients while leading the team. So we're continuously evolving and adding new things, but we do care management. We have a panel of we might be up to 1,500 Medicare patients that we follow. And some of it is making sure they're getting the care they need and the specialists that they need. But a lot of it is also prevention. So Dr. Donahue has developed these different pathways. And right now we're doing a outreach for our hypertensive patients. So it's a very strategic outreach plan that targets those patients who have a diagnosis of hypertension. And it's all lifestyle medicine based because our care navigators, we have to work within scope of practice. So they're not talking about medicines or they're talking about lifestyle changes to make is a big part of it.
Yeah, I've seen Dr. Donahue's pathways are amazing. And I knew he was doing the hypertension groups now. So I'm curious to see how that goes. You said something right then. You said you commented on scope of practice. Can you touch on that a little bit? The care navigators, do you train them? Are they medical assistants? What is their role?
So we have 4 care navigators. 3 of them are trained medical assistants, and 1 is a social worker. We have done extensive training with them. Of course, they can't talk about changing medications or anything of that nature. They're not doing assessments, but what they're doing is strictly following those pathways. They also do a little bit of care management as far as if a patient needs a specialist, they help with facilitating that. Or if a patient has financial issues, how can we take that burden off of them so they can focus on their health? Or maybe a patient doesn't have a ride to their doctor's appointment. How can we get that service for them? So they do a lot of that work.
That sounds great. And what you're commenting on there at the end, what I heard you say is that you do have some assessment or built-in exploration maybe of their social determinants of health.
Oh,
right?
Sure.
Which is an important piece now, right? So even like you just said, a ride or finances or what to remove barriers that may exist for them.
Sure. Yep. We actually do a social determinants of health survey with each new patient. So we are aware of if there's any issues. We actually had a student intern actually it was last summer, come and help us develop that. So that was really helpful.
Awesome. So that's something that you guys developed. You didn't use one that already exists?
We developed it.
Okay, very good. So what does your day look like? Since this is a little bit of a new territory, tell us, what would a normal day look like to you?
My typical day is I focus on the hospitalized patients first or the recently discharged patients. So that is our priority as the nursing team is to, if a patient was discharged or if a patient's currently in the hospital, we're doing a lot of communication and follow up with them. What medications changed? Why were they in the hospital? What can we do to prevent that from happening? Do they have everything they need to not go back into the hospital? So it's a lot of, and in the beginning of my day, it's a lot of, I guess you could say, regular ambulatory nursing work, right? But we do mix in the lifestyle medicine aspect when we're looking at what could we have done to prevent this, or what can we possibly change? And it may not be changing it right there and then, because the focus at that point is making sure they're safe and do they have what they need? But it's always in the back of our minds, what could we do to prevent this? So maybe in 3 or 4 weeks, we talk about activity, or we talk about nutrition, or we talk about social connections, whatever it may be that could have contributed to the problem. Yes, that's how I usually start my day. And each nurse has a panel of patients that we follow. So some patients we talk to every week, some patients a few times a week, and some patients maybe once a month. So it depends on the particular patient, but I look and see there are certain patients I have scheduled on my calendar I talk to every week. And sometimes it's just talking about, all right, what was your activity this week? Or how are you feeling if they're congested? Are you avoiding dairy? So we do incorporate the lifestyle talk within those conversations. And then another part is optimizing the teams, doing those leadership roles for the team, trying to always figure out how we can do things better. An example is we started to notice an uptick of kidney stone patients. And that's typical in the summer with not drinking enough water and those sorts of things. So we put together an educational handout for those particular patients. And it's strictly water intake, what fruits and vegetables, avoid animal products. So it's very specific, incorporating those pillars into the handout. So just looking at like, how can we make things better and improve our process?
So that's great. And it sounds like You guys are responding in real time to needs, right?
Yeah. I look at our team as advocates for the patient. We each have a direct number they can call, so they don't have to go through the main office. So if anything were to come up, they know that we're available for them. And that's been really important as far as maybe a patient's not sure if they should go to the ER. So they call us and here's what's going on. And we can figure out, do you need to go to the ER or what is going on in that situation? And just to have somebody to talk to as far as that one point person has been really key in improving care.
So it sounds the nurses are really taking the lead in terms of being a lead on their own little team or their own panel of patients, and then also the leadership roles that they're playing within your practice. So that's great. So what do you think some of the biggest challenges are? Either the biggest challenges within the practice, like from your own perspective as a nurse, and the biggest challenges in bringing this information to your patients?
I would say we depend a lot on home health and other outside sources. So we're trying to improve that communication between primary care, the specialist, home care. It's better than it was years ago, but there's still definitely room for improvement as far as coordinating that care and making sure we're all on the same page. So I would say that's a barrier. If there was a system where we could all communicate together, that would be wonderful. I would say that's the biggest barrier. The biggest barrier for patients sometimes can be financial, can be a barrier. I've heard this a couple times this week. I can't afford that, so I'm going to try to do this instead. Or there's a myth out there that eating healthy is expensive, right? So we try to show them different ways. And there's a lady now who has a website, Plant Based on a Budget, which has been really great. And she has a lot of recipes that are budget friendly, but just trying to show you don't have to buy, and it's really not healthy to buy like the fake meat and those type of products. And they are expensive, but if you're buying beans and rice and whole foods, it's actually cheaper. So trying to just educate the patients on how they can incorporate this lifestyle since they've been eating a certain way their whole life. Right?
So there's some mindset shifting in there too, sounds like.
Sure. Habit building is big. So trying to build those habits. I really like the book by James Clear. It's called Atomic Habits. And it really gives some good strategies on how to build habits and lumping different habits together or lumping something positive with activity. So maybe listening to a podcast while you're walking and that kind of incorporate or lump those two activities together. So you look forward to listening to your podcasts and then you're walking at the same time. So trying to get those strategies and help people change their habits can be tough. But.
Yes. Yes. So I have a couple of questions, or we have a few more, but so do you have a success story that you could share? Any patient come to mind?
There's so many, but there's one that comes to mind. I actively work with her. And again, the nurses are taking care of patients with multiple chronic conditions. We get like the sickest patients in the practice. We have a patient, really bad COPD, malnourished. There's multiple other conditions that she has. And I have been working with her pretty closely for, I would say, 6-8 months now, and trying to get her to eat different things to gain weight, which is usually the opposite. We're usually working to help people lose weight, right? But for her, it's more gaining weight and trying to do exercise when the breathing is a concern. So my philosophy is always baby steps. We're going to do baby steps, and we're not going to try to say, okay, you need to eat right, you need exercise, you need to do this, you need to do that and that, because it just becomes overwhelming and they give up. So incorporating baby steps, and again, using those forming habit strategies, strategies from that book. But all right, so we are going to walk for 5 minutes after lunch. And to us, 5 minutes doesn't sound like a lot, but for her, 5 minutes is huge. So we did that habit stacking, as you call it. And now she's walking daily, and we got her husband involved, and she has definitely improved. She's not and I have to knock on wood, she hasn't been back in the hospital. And oh my gosh, it's probably been 3 or 4 months. And this patient was in the hospital probably every other week. So just different strategies with the social connections. Who are you talking to throughout the day? Who is your support? Again, lumping that activity. What can you eat to feel healthy? What can you eat to gain a little bit of weight? That's been one that stands out. Another one that stands out, and again, there's so many, I could probably talk about this all day, but is one that lived in assisted living. I don't want people to give up on people that are in like an assisted living facility or nursing home, because there are ways to make a difference in those facilities as well. So she has a diagnosis of heart failure, and she was dependent on what they were cooking. So she was like, I can't control what they are cooking. I eat what they serve me in the dining room. So we decided to work closely with the nutrition staff at her assisted living facility, and we were able to get her low sodium food. She didn't go 100% plant-based, and that's okay. But she started eating more vegetables and started to incorporate some of those habits. She is also wheelchair bound. So activity was a challenge. I was trying to figure out, how do we do like exercises in the wheelchair? But we were able to find chair yoga for her. And she was so excited, and she looked forward to it every week. And it just really made a difference in her attitude and her demeanor and everything, because she was feeling a little hopeless, right? That's another one that stands out. We were able to get her feeling better and keep her out of the hospital with some of those strategies.
Right. I love both of those stories. They're very inspiring, especially for people who start feeling very hopeless, because I feel like that's a big deal. And the woman not being hospitalized for a few months after going every other week, that's a big improvement, really big.
Yeah. Like I said, I have to knock on wood.
Yeah, I want to ask you. I'll knock on some too. So I would like to know, I want to hear a little bit about the reimbursement piece. Like, how are you capturing what you're doing and being able to show your value? Are you able to bill for any of that? I know with Medicare, it may be a little, I don't know if this is true, but like a little easier with Medicare. Do you have a large population of Medicare? What have you found for billing and capturing your work?
Sure. So most of the patients that we support are Medicare. That's really the major focus of the care management team, is to focus on the Medicare population. And we do get reimbursed through their CCM program. So it's been, again, trial and error trying to figure that out. And it was a little bumpy there, but we have a pretty smooth process now as far as keeping track of minutes and submitting those to Medicare for billable minutes. So it does help us support the work that we're doing, and helps support the care that we're providing, and saving money for Medicare as well by preventing those admissions. So it's all in.
I love that. Is there any other tool? I know you said tracking your minutes. Did you build something out to track those minutes? Or is there any other piece of that Medicare chronic care management, any other tools you found helpful?
So there are a few tools on the CMS website, but we had to develop our own way by using our EHR, and we just it's not the greatest way yet. I'm hoping maybe somebody can develop something wonderful for that. But basically, we just keep a running total of the minutes throughout the month, and at the end, we submit it to our billing team. So they get a flood of notices at the end of the month.
That might be okay.
Yeah, they haven't complained yet.
That's right. That's right. As long as they're not complaining or providing feedback that you could act on. So let me hand it over to Deborah. Deborah, is there anything that we talked about already you want to circle back to, or do you want to go into a little bit deeper with some other, like the future of nursing or something like that? I want to shift gears a little.
Thank you, Susie and Stephanie. Wow, it's so exciting. I think we all want to be there with you. That's wonderful. A couple of things to circle back on. One is, can you share with us what EMR you're using there?
We use Elation.
Allegion?
Elation.
Elation. Okay, I'm
Yep.
sorry. Yes, and you probably are able to make adaptations to that to build in some of these for the coding for the nurse time there. I think one of the things we're hoping to answer for practices is how to be able to, number one, how to be able to bill and benefit from the time that nurses are taking in a practice so that they can do more, so that a practice can afford for that. And so that nurses are on the other side of the accounting equation. So that's really exciting to hear. And that Medicare model does allow for that. Another is, might we explore a little bit more about what the nurses are doing in terms of the management? There are medical assistants and a social worker that are providing a lot of support and follow-up and education, and then the nursing team. I think if we might be able to just flesh out a little bit more, one of the barriers for nurses out there is, I think, in part, having others define nursing scope of practice, which you mentioned, the scope, work within scope of practice, and also that in some ways we are educated about it generally, but with this new field, as we're talking about this field of lifestyle medicine and implementing these very specific recommendations, and at the level that you're working with these patients, might we explore a little bit more about that and how you're managing those patients in terms of recommendations for what they should be doing or not doing?
Okay. There was a lot there, so I hope I answer all your questions. So to start a CCM program, and I think that's what you're asking, how do different practices go about starting this and justifying the work of a nurse or being able to afford a nurse, right? Really, you would have to look at your Medicare. I think the first step is looking at your Medicare panel. How many Medicare patients do you have? And within that panel, how many would qualify for CCM services? In order to qualify for CCM, they would have to have 2 or more chronic conditions. Unfortunately, that's pretty easy to find. So hypertension, heart failure, diabetes, high cholesterol, the majority of the patients probably have, unfortunately. So then you would look at, all right, how many patients do we have that fall within that parameter? And if you look at the reimbursement rates for Medicare, and it's different depending on how much time you're spending with a patient. If you're doing a lot of complex work and there's different levels as far as the reimbursement goes. And that could be a whole other conversation I could go into, but majority need at least 20 minutes to get reimbursed. So if you're spending 20 minutes or more with a patient each month, you can submit to Medicare for reimbursement. But I think it would take some analyzing to look at how many patients does a practice have and how much time would a nurse be able to dedicate to those patients. So there's other things that the nurses are doing within the practice because we do not have a practice nurse. We also do practice nurse work like triaging calls and helping the providers with some of their lab results and specialist consults. So we do that work as well. So we set a goal to dedicate 30% of our time to the CCM work. So there are benefits as far as, and sometimes it's hard to see the immediate benefit, but if you look at a nurse being able to triage, that triage could have saved them from going to the ER. And again, that's an expense. The ongoing care management could have, and it does save patients from going to the ER. So you save in that aspect. So sometimes it's hard to see the immediate return on investment. Sometimes you don't see it for another 6 months when you look at your Medicare data. But if you look at overall, and that's with any prevention, right? It's hard to see the immediate return on that. But if you look at what's being offered and what it can do in the long run is where you really get that benefit. I don't know if that answered your question or not.
Thank you. That was wonderful. And I apologize for stacking a few things together. That's really helpful. So it's not just in the reimbursement for those 20 minutes per month or 30 minutes per month, but also down the road when the patients that did not end up back in the emergency room every other week, and then Medicare saved that money. And then there's the reimbursement model on this finally we're at a place where practices can benefit and from keeping their patients healthy and out of the hospital. And that's really wonderful.
Could I ask a quick question?
Sure.
That I thought of when you were talking about how do we even capture our preventative strategies, right? So are you guys tracking any outcome data, like with specific patients, like how many times they were hospitalized compared to the previous 6 months, or like any kind of, I don't know, I guess that evaluation piece in terms of that, not necessarily capturing reimbursement, but capturing the good you're doing?
So we do need to improve that, but we have all the data. We just have to go in and analyze it because we do track every patient as far as every hospitalized patient. We're tracking our care management patients, but I need a better process for actually showing that. I can tell you that, but it's where is it in writing, right? Yeah, that's something that we think about as far as like, all right, here's where we were. And I know Dr. Donahue has some of these numbers because he talked about our readmission rate it dropped substantially in 2022 once we implemented this program. So he probably has the data on that, but I would like to track some of that a little bit better.
Thank you.
Sure.
Can we talk a little bit more, Stephanie, about scope of practice? One of the things that we encounter when we speak with nurses is, I'm in cardiac rehab, but I'm told that I can't talk to my patients, and this is an RN, even someone who has a diplomate in lifestyle medicine, but I can't speak to my patients about what the science says because the other team members that are in the dietetics or the medical provider that doesn't have the same practice model in terms of what they recommend to patients are saying, that's something that we want you to stay away from. And I guess we'd really love to hear from you as a fully empowered team of nurses about how you would describe and define a nurse's scope of practice.
Yeah, absolutely. So it is our job to advocate, and it is our role to educate the patient. I'm actually lucky that my boss supports us 100%, but I came from an institution that I ran into some of those same barriers, which it's hard to wrap your mind around that would actually happen. But it is our job to educate. It is our job to research is part of our role to stay up to date with what's the latest and greatest, right? And again, it is our job to advocate. It's unfortunate that leadership in some of these bigger hospital systems do not support lifestyle medicine, but I am starting to see that shift. I see when I review specialist reports that come back, I'm starting to see more talk about nutrition and lifestyle modifications, which I did not see that 6 months ago. So I do think there is starting to be that shift, and we have to stand together and we have to speak up. We actually, before I left that organization, I was able to team up with a few nurses and nurse practitioners to develop a lifestyle. What would he call it? Lifestyle. We called it, it wasn't lifestyle medicine. I can't remember what we called it, but it was a group of nurses and nurse practitioners that we're very passionate about talking about this and educating patients about this and making changes within the organization. So I know that still exists because I'm still in touch with one of the nurse practitioners that works there, and they are making some headway. But I think it does take a team, and it takes a lot of voices to get the word out that this is important. And I think people are afraid of how it's going to hit their pocketbook, right? Unfortunately. And is it going to reduce my visits, or is it going to reduce our work. And it's our job as nurses and why we became nurses to get people healthier and to do what's right for people. Again, I think what I would recommend is getting a group together, finding those people in your organization that feel the same way and are as passionate about it as you, and try to make baby steps. Just try to make small changes, and maybe who's in charge of discharge instructions? Can we talk to that team and put a lifestyle modification section on the discharge instructions? There's what you need, what medicines you need to take and what specialists you need to see, but can we change the discharge instructions for hospitals to say, these are the lifestyle changes you should make, right? Or add. I like to say add because that seems to work better than don't do this, don't do that. But I think that's where we can make changes overall.
Thank you so much for that. That's really helpful, is find others in the community that you're in, the organization, other stakeholders, make baby changes, and find where you can just institutionalize something. And I think one thing that the practice has done so well, and you continue to evolve and do, is to not reinvent the wheel. And so you have these amazing pathways and you continue to improve. And then you say, oh, we're seeing an uptick in kidney stones. So let's develop some content around that, some screening and some education, and boom, not everyone can be speaking from the same page and knowing that it's based on the evidence, and you're running with that. It's like the Atul Gawande and the checklist that we know is so important. We don't have to keep reinventing the wheel. In addition, we'd love to just speak to ask you, with your enormous experience and your role here, what you think might your message be about nursing education that you would love to see start to happen in education if you had a magic wand.
Oh, yeah, I wish I had a magic wand. So I was in nursing education for a while and taught nursing students as well as new nurses to the hospital, and super passionate about teaching. And I would love to, and I advocated for an ambulatory curriculum for a while because there wasn't really any education about ambulatory nursing. And this is before I, became a lifestyle medicine nurse, but the curriculum is very geared towards acute care and medicine, and how do we take care of somebody in the hospital is a lot of the curriculum. So it would be wonderful to have a lifestyle medicine course for nursing. I know they're starting to add that to the medical students, and it would be great to see it for nursing students. I would love to do that. That would be so fun. But I think that's if we make it standard for everybody. I remember having a nutrition course in nursing school, but it was more about what vitamins are fat soluble. And I don't remember a lot of, and maybe there was, I just don't remember. It was a while ago, but I don't remember a lot of talk about animal products or different aspects of nutrition. It was more like, this is what the vitamins are, this is what the minerals are, right? Type of thing. This is fat soluble, this is water soluble. But it would be much more beneficial to actually teach them the 6 pillars and what aspects of those 6 pillars can you immediately make a difference with in patients. I think that would be wonderful.
Mm-hmm. And you have your master's in nursing education. So I'm sure if you're not engaged in making some of those changes now, I think down the road we're going to hear more about that with all of the experiences you're having, and you're having impact.
Yeah, let's start it.
Thank you for that. And hopefully with the essentials, the new essentials, it is coming around to some of the underpinnings rather than dealing with all these, putting everything in silos. Oh, this is heart disease. This is diabetes. It's endothelial dysfunction. It's metabolic dysfunction. It's inflammation, all of that kind of thing. So hopefully we're going to move in that direction with our nursing education to bring it to the point where it's all about what's the underlying process, which is what lifestyle medicine is hoping to address. Might we also, you're dealing with patients every day who have multiple chronic diseases. You are addressing the social determinants and assessing the social determinants of health. Susie and I are both inspired by the National Academy of Medicine's Future of Nursing 2020-2030 report, which comes after the 2010-2020 report insisting that nurses be supported. And here we had COVID, and the 2020 report leading into 2030 as COVID pulled back the curtain and shone a light on the importance of social determinants in the outcomes for these patients. They put nurses at the forefront and asked stakeholders to support nurses so that nurses can do what nurses do, which is assess for all of those things, educate, empower, connect, and treat the whole person. Do you have any thoughts about any of that, or any messages for any stakeholders about how they can support nurses given this calling at the national level to help support nurses to lead us out of the place that we're in right now in health outcomes in this country?
Yeah, there's a huge discrepancy between healthcare availability, and it's based on what insurance you have, and obviously transportation and what's available in your neighborhood as far as food availability. I have seen a little bit of a shift, obviously very close to New Jersey, and they just passed something about offering people that use subsidized WIC, they can go to the farm stands and they have a certain amount towards farmers, which is really a huge improvement. So I would like to see a more shift towards those kind of changes in what food we're subsidizing and what kind of care we're subsidizing, and would be a whole insurance shift, right? Of what we're paying for. And because I feel like insurance is driving what people are going to be able to do. But I would like to see, instead of subsidizing meat and beef and dairy, can we subsidize more of the vegetables and more of the fruit and put that food in neighborhoods that don't typically have it? So they have corner stores, and if you walk in, it's junk. They don't have those options. So I think starting at that level of what's offered, but also offering more transportation, maybe subsidized. There's a lot of changes that need to happen. It's overwhelming to even think about everything that would need to change, but some states are headed in the right direction with that as far as food availability. They're starting to see that. So
I love that. Can I comment really quickly? And then you can.
Of course.
I remember listening to, Marianne Nessel talk about how our government plate says half of the plate should be vegetables and then the rest divided up. And I don't remember the number exactly, but it was only the tiniest amount of subsidy goes to growing fruits and vegetables for our consumption. And she talked about the stark difference between the money that the government uses to subsidize that growth and what we're being told to eat.
Interesting.
So, yeah.
And I want to back over to you too, Susie. And thank you, Stephanie, for your precious time here. I would like to ask if we can circle back to your experience in the intensive care unit, the cardiac. You were in the acute care setting for a number of years. And if you reflect back on that with all that you've learned now and all that you're doing, if you would have messages for those nurses about what they are empowered to do as a BS nurse in the bedside with a patient being discharged from one of those units, or helping them make food selections, answering their questions, what you would say to them about what they can, within their scope as a nurse, speak to their patient about. And then fast forward to today, how you would guide nurses in terms of their own self-care, knowing what you know today, particularly in the acute care setting where we have shortages every day. And those shortages, we have nurses that are under enormous amount of stress and are departing this setting because of the stressors there, and what you would say to them. So backtracking to those nurses with their patient, and then also for themselves.
Sure. Yeah. If I knew back then what I know now, then I would definitely suggest providing the research, the science, and you're not giving patients bad information. You're just giving them what is actual science, and let them know you don't want to come off as, oh, you have to go vegan. And I think some people get so excited about it that they immediately go there. And I think it's more, hey, how can we keep it simple? How can we add more vegetables to your day? How can we add more activity to your day? Are you interested in learning more? Are you interested in staying out of the hospital? Or if you ask the patients these simple questions, would you like to know more about how to get off these medications? Instead of saying, if you ate this, you wouldn't be here. That would never work. But just offering them suggestions. How can you do this? And letting them respond to you. I think I can add one more vegetable to my day. How are you going to do that? And use those coaching methods. And that could be a big part of it too, teaching these new nurses how to coach. And maybe that's another part of the curriculum for nursing school. But how to do motivational interviewing with these patients and getting them to say, okay, I want to do this. How do I do it? So something that we have incorporated, and we start every meeting like this, we call it healthy habits. And it's all about self-care of our team. And it'd be great to pass this along to other teams, but we pull up, it's just a simple slide of the 6 pillars, and it's titled Healthy Habits, and it's self-care of us. So we talk about, hey, did anyone try a new recipe? Did anyone do a new activity? Did anyone find a way to reduce stress? And we talk about that for ourselves, because we all learn from each other. It's so important that we do that, because we all have these ideas to share. So we have that forum available before every team meeting, and it really has opened up some great ideas for not only ourselves, but for patients as well. Because if you're not doing these things, how can you teach somebody else to do them? But that'd be great to share that with other teams when they're doing their huddles or any kind of team meeting that they have, if they have a staff meeting. It's a great way to start, and it's a fun way to start. The team seems to enjoy it. And again, we all learn from each other about different classes or different breathing methods, or it's all different every time. So
Thank you for that. It's a means of getting a positive energy going, connecting everyone. Ideas are generated, and it's as if in coaching, we ask what went well today, what was good about your day versus what happened today. And so we just get off to this positive energy, and then everyone goes out there with new ideas and kind of fired up. So that's beautiful. Thank you so much for all of this, Susie.
Yes, and we've kept you about an hour, so we're going to wrap it up. But we so appreciate your information, your insight, and the wisdom, and all of the things that you've already experienced. The only question we have left is, if there's anything we didn't say or didn't ask you, is there anything on your mind that you would want to share with someone listening to this or discovering lifestyle medicine for the first time, whether it's a team or a nurse?
I would just say be open to it. And again, I want to emphasize that you do not have to go shift your whole lifestyle all at once. But there are so many great books out there and audiobooks for those who may not have time to read as much, but educate yourself or go on websites like Chef AJ is so fun to watch. And there's different sites out there like the ACLM site where you can educate yourself. There's another one called Full Plate Living that uses like a 75-25 philosophy, which I think is great for people who are starting. But just be open to it and not think, no, I don't want to eat that way, or I don't want to. People may think it's not real. It's just like fluff, right? And I would say just keep an open mind and educate yourself about what is out there and what it can do. Look at success stories of other people. I think it's so inspiring and that's why I like Chef AJ. I feel like she always puts somebody on there with a success story. And it's super inspiring to see how people have changed and how they are off medication and just living a happier, healthier lifestyle, which is what I would think everybody would want. They would want to be healthy and happy. So So again, I would just say keep an open mind and educate yourself.
Yes. That's perfect. That's a perfect way to end. Thank you so much.
Absolutely. Thanks for having me.
You're welcome.